We want some demo me can full VDL motorbike amount and anti-kama fuel consumption jet VDL aboboya ewa hoɔden etumi before any load bia VDL omo durable tires akesie pa the Caterpillar tires articulator any nketua ensanso enwintem ensuro load bia mekyerɛ suitable for all terrains. VDL pure virgin premium lubricant to say engine oil, hydraulic oil, and gear oil, specially formulated for peak performance. O engine besu kama no fitamubia. VDL batteries also a powerful, reliable, and strong. No yempia. After sales service so 8 VDL Nema a to 4 Fred 0243 67 5020 Kumasi Alaba and Crime Caprice anywhere VDL Ejatuatua Ejadum long lasting. That's VDL.
Imamunina Jo Deba Kapital Radio 97.1 FM, the heart of music. So, Majidi se Ubia Hoye, Nakupa Domenso Mehoye, Papa Pa. Emrena Drew, Emreno Asa Edru, say Yibisuya Bibi. Enyanemre. Program we dia Winimuno, and ye Kamwasem. Winim Kra Tie na so free. Na dia wonim no na wachire ene de wo doctor e wo yi studio ha na oni e betwetwe nkomo de bi obia MN radio program no etwagu live infoni no e wo YouTube e Kapital Radio 97.1 FM, the heart of music. Ye Capital na e ki enye si wadaroma oye gospelisi a unhuyen Eye colors no eye koko fita ena tuntum Uhuna 97.1 ubehunu straight. Go see a logo na beto na live also. Esan tregu of Facebook, same thing, Kapital Radio 97.1 FM, the heart of music. And also sa spelling no K Kapital 97.1 colors no sanity. Okohwa momodia nedi echi follow, like it, subscribe. Na bribia program we ebaba live bia no betie bi. Muti Capital Express anyum to phone na afi no ma shasi o ma shasi efifi no. Yeda mo sipi se mo hye wo mon kran mutie ye enche no ma mo so ama be stars. And sa na ebinum omonsa ebe call ma no. Ti ye boa wo mo na mo so ma boa wo mo na ma call manim. Gallant Christ Has Church and so almost some of the Yankopon asem ebre yen so yebeka apomuden ho asem atiro ye wia peske almost some beka apomuden ho asem sronko bi eno de almost some de I to say clinical say hospital ya sabia o say problem ya o na wakoho na House of New Glory so e de Yankopon asem abrain nti mamu ni mo afide ni free ha me kai mo say VGL Varun Ghana Limited omo no maso ya sene omo batteries papa correct one pa na udi su kaso a afibo we yi wani kura enu ane se wo tenita na ye kama so wo tenita na ye kama nko ade a battery ne de be chama me ha many encan patakota 4 years 5 years ebedi 4 years 5 years ebedi so what tenita na ye kama nko ade a ebe ye adwuma ma omo akese pa edisi articulator so akese pa omo ye mining unse mining for no more trucks na akese pa tintin gram on the tires kura e wa cheme omo sa trucks no say the omo tires ni bi ho omo tires nso a nkete omo twin load ni omo passenger tires ni nyina omo obi smooth omo rough omo de na de wo omo de ahoma so wo omo tires ne de ya ye ho research aye ho bibia obo breaker afibo still enwe ntam oto VGL tires go cars ya no say yes money well spent obroni beka omo sanso oil premium oil high quality oils friend virgin oil and all the good came and we be ne go me came o start here engine is so traffic mu kwan kura the VGL or more oil almost our hydraulic oil and oil so it go motor engine mu ne gear oil ni na mu obi almost so 3 tires abubu ya moton 3 tires abubu ya na nya abubu ya bia na abubu ya wa ho de fi abubu ya de say niam na de soa nti abubu ya no nya abubu ya ye kama it me fro bepo omo abubu ya no we helping gear nti say we helping gear we ni tua ai tu America wa ho de wo de ye adwuma tu say bucket no eso na nade na omo de aye abubu ya no wa ho de mpa mi wo bi eno ana me de medwuma mi wo mi enu kura eno ana me de medwuma efi say ye papa nti eno ana me to munyina mu nkoto VGL 3 tires ne bi abubu ya no musan wo 2 tires so person delivery na nsem se no na aba so delivery the bebro se sia wo am so person ja contemporantem wo tene wadwuma na tia no person bi liter 2 tires na bebo omo helmet ne bibia omo wo bi omo spare parts etufuo bo so omo ne ma ne etufuo bo from 0243 675020 0243 675020 in crime we hu omo ka price Kumasi ya omo Alaba wa anso omo ho 6 minutes to 6 na mi wo Dr. Richmond Amu ewofia Dr. Mimwajo
Yeja mejoso
oye
nyamya do boko
bia boko
nyamya do ko kakra bi na cheba me ne dai
ona se we doctor nti
problem bi kakra
problem ye do what that sorry na we ko what that sorry we ko na se doctor je monyare ana
kakra yeso enipa
ye we adwin mu de monyare muna mo say
nyamina ne boye ho ban
ai abi munim bibia yo ene ye beka na ebedi awo emu nkomo kuni mo bia ontumi nwo ope awo a onya die nti na ama na abasa ayo how amano ɛmaa no na ɛyɛ ha wɔn paa fi sɛ wɔn na sɛ kura pɛ sɛ ɛdi watam kura sɛ wawo yɛ no ara yɛdidi atam ɛnwanwa o obi betumi ka sɛ o kura wawo da ɔsɛn na wawo yɛde twa mpoa nyinaa na ebia na deɛ haw no nhyɛ da anya deɛ haw saa nanso wonim nti na baabi a wɔfafa no a wɔde pɛmmoa no na akɔyɛ sɛ yɛbu bi saa no yɛgye wo sika adi kɛkɛ a yɛn ho yɛhwɛ nyiye nti ɛna no yɛbɛhwehwɛ mu ahunu menim papa bi menim baabi ɔnam sisi ɔnam sɛ na ɔyɛ bank manager saa time na yɛfrɛ no Barclays Bank wo sɛsɛn na ɔka ɔse ɔwareyɛ iteki no 10 years ɔbaa no ansa na ɔbaa no ɔnyi nsɛn ana ɔmanya ɔmo first child na ɛno twam no deɛ awɔ no toatoa so saa menim deɛ maa no kɔbaa saa after 10 years wo ɛnyɛ ade ketewa nanse nso movie a yɛyɛ na asofoɔ ne friend sɛ akontafoɔ no wɔn a ne yɛteto menim sɛ na ɛnɛ mu sɛ ɛsaa nneɛma no da so wɔ hɔ deɛ a mentumi nkyerɛ na how to atwa Dr. Richard Amu yɛne na bɛdi nkɔmmɔ doc
yes sir
yɛsɛ obi ɛntumi ɛnwo a aseɛ kyerɛ sɛn deɛ ne ma ne basa
yo medase ma menkyia wa ankasa ɛne watiefo nyina baabi obi a wɔtie me biara no mede nkyia soronko free Capital Radio studio ma obi biara ɛka sɛ infertility ɛm sɛ brɔfo puto yɛbɛka sɛ infertility anaasɛ obi ntumi nwo deɛ kyɛ nyinaa ne sɛ ɔbaa ne bɛrima sɛbi ɔmo aware mede awarefoɔ yɛ that's the ideal example I can give anaasɛ ɔbaa ne bɛrima te na ɔmo pɛ sɛ ɔmo nyinsɛn sɛ ɛka sɛ ɔmo yɛ infertile a awɔ sɛ ɔmo tena bom awɔ sɛ abra no nyinaa ɔmo di ahyiamu meka sɛ nhyiamu a sɛbi puto mebeka say they should be having regular unprotected penile-vaginal intercourse. So mbezem kanyina say oba ne bema ne beden ebeda at least in premier sankosi in pre9 so na watch bia amumbom ho ban safo mfie bako and I say bosumi dumienu I mean 1 year is 12 months ti bosumi dumienu is after 1 year no na say no ma mabobosu conditions mabobosu omuti together sebi omudi nhyiamu sɛnea ɔsɔ mu di nhyiamu ɔwɔ abra mu mbɔ mu ho ban ɔmu use any form of contraception ɛna afei so no nhyiamu no so yɛ ntoatoa so frequent at least 3 to 4 times a week saa afe baako na sɛ nyinsa yɛ amba na ɛneɛ ɛbɛtumi aka sɛ saa couple no ɔmo yɛ infertile deɛ yɛka sɛ obi yɛ infertile anaasɛ obi ntumi because me the web obonini but for now esan see a catchy nti ma menka say obi oboni a that is the basic definition idea there
obi a want to mengo want to mean nyensan na
wawo no nti couple because remember it should be a couple because it takes two to make babies two near oba any bema nti na couple no two oba ne bema tina so mo edampo we da ha we da na so mo ndi hyiamu a and so no insanye day intimimba that's also a condition and even po some mutina mudi nhyiamu no pokra no yes I say or say nhyiamu timi hyiamu empremian sakos ni nan so na wotwe bia at least 3 to 4 times a week and I was saying kamatina says also for afebako into once all these conditions are maboboso yi and after kwani kwa some bomb ho ban free nyinsɛn ho I mean you should not be using any form of contraception. What you say? Once my boy we nyina so na se mo ye we nyina mo mbɔ mo ba na bibia pepepe na nyinsa ma de a and there's not sa our phone o me infertile tiniti nyina no
deɛ ne ma ne basa
no ma bebre ma me ma the normal because the normal physiology ne ni peduna yi se bibia pepepe de bisia ma nyinsa etimi aba sa you who the normal na afei de media project akɔde abnormal sɛ de bɛte ase ɛkwan fa so ni pantimi de nyinsa ansa na oba
Capital Radio 97.1 FM so na wuti abo anwumre ntia
ebu enya normal cycle nso mo bu mo nsa can say abusun yo mu coach ma efichire sorry obubu ni nsa they have to menstruate. The menses have got 4 phases.
But what can you
almost menses in the war achichemu me 9 phases 9 back when the first one here baby omobu omonsa no that's the bleeding phase, that's the menstruation hono obaby betimi abunisa from 3 days to about 7 days depending on the cycles in the city. Sabre na obu nsa no na oba ne kosua na ewo ho no nsisa bi ye den ekoso because hona ovary na hona obetu ne kosua na free enti every follicles ebra obu nsa na follicles no so start to grow because in the pedua na adwene mu no ye no mebu o mu anyakopon de adi adwene mu free be hypothalamus free be pituitary menya technical but just to appreciate what I also want to say. Ti amono so produce nuro bi eba ye mojamu na be glucose ba bia oba no tino kosua ne free no na no so start ensisan ye den eba obe produce bi e friend no follicle stimulating hormone na ama ba bia obetimi to kosua free no ebe ka sa hormone ni ebe ma sa follicles na nyini na afi nyini so a na eboa na ma ba kwa be dead ya no ho den pa ye be to kosua ma kosua na den aba na sa kosua no time on betu kosua no sa phase your friend ovulation phase into your menstrual phase, follicular phase, then ovulation phase on the to kosua no kosua ne baby ya na sa follicle na to kosua na no enu so bitimi be je friend corpus luteum sa corpus luteum no be produce be friend progesterone na no so akọ awodi enim na akọ prepare awodi, and that's the luteal phase awodi enim mira na ewo mu no na ye kama se na ebe ya so kosua na ya to no eni bema hun kwamwa kushia na se e form moja motor as in it forms an embryo moja to na eye akora ne ba be tawo de nim na e be tawo de nim awodi na ready se be den be je you can say fertilized ovum na se moja to na form no se ne be bitime de e grow kama on se ne sitian enti for pregnancy to be achieved e was say no ma mabobo so yi me can train tia one kakra but me can bro man ke be clear but my can train so sir
oh yet I say
no ma mabobo so I say each of them have to happen nti also oba no onya kosua ovia no ho ode betimi atun kosua afi so anya so otun kosua ne keke o otu kosua na e fa dro ban bu mu e friend fallopian tubes eho e na be ma no nkwamo ne betimi ne kosua na di ahia mu na fertilization na den take place na afi de nyinsen na esino abeta wodi enim so the tube should also be patent and functional. Let us say obano tubes no the droben na otunkosu ane fam no e wo se mu da ho e na nyese mu da ho keke e wo se timi so eye adwuma go ka say a tube is functional say nyinsen take place wo se timi move the fertilized ovum into the uterus to propel it towards the endometrial cavity. Sine be ya piano now that is the functionality of the tube. Of course, apart from this, no. Sebeta, I was ready. I was in the city. I was ready because I would say mudaho. I was saying run a woman a kama. Because remember, saying run a woman in your kama, you send it to my ebessay. So I would anymore see you send me betoma a ebessay. If you have money, go away, be woman. Now, Oma would you better say a much of you know. Any concept banisa. If we are quite bonkononi, I would dear cry. Absent uterus. If we also more separated uterus. I say, I would dear Nankasa so inseminate me bang. Obu also. Obu no yare. A bit say, Mamma say fibroids. And your fibroids not the cause infertility, but depending on where it is, the location of the fibroid. For instance, say be a
fibroid. I don't know.
I'm going from Sia Quine. I think say tree one friend is Sia Quine. Sia Quine. And I say, I think Sia Quine. That's what I'm a friend. And you see, one of the benign tumors a better awudi anima e bitimi say especially a dawudi anima nkasa na say biawudi anima bitimi aka wodi no emu tokro no the cavity no it can more or less distort the cavity and you say nyi say nkra sia entimi ngina bitimi adan apone ma men kan sa banye ni nyina na etimi ma nyi say den and I say nyi nyina na sinyi say ho kwan because different types of it e bi wa awudi na bonten e wonachi maybe a subserosa. I don't say unless a sopana be and I say it's so huge enough to be able to compress or destroy the cavity. But other than the subserosa ones will not cause infertility. If you say pedunculated, and so I would be bonting, and also intimate cause infertility. But the what would be any mono? Submucosal ones which are big enough to occlude the cavity. And I say so pass a big cavity, because a cavity I would be any to chrono. I was saying Kakwana Codano. The bit me a cancer, Siaman in San Day, intimate day, engineer. And he said, Obi, there be no problem, ya, and there's a one named Kusia Tumuno, Sabio, or by me call by the SCA, Abian and Koye. 2. The Druban Susuna or Tunkusian Panko said Femina, Nins and Itimi Bano, and also Abiana and Koye. 3. I would Diana and Casa now, you trust no answer, I was saying, Mudaho Kamakamana, Nins and Itimi, but to me, Timijana Kamakamano, Abian and Sun Koye. Apart from that, I would no. Your friend of service. You see, the service also has a critical role to play because if you bear man in Hobe call Bahua, bear man in Suno to go about who I befa sa service him, and that's what we anonym now cosro, then you could see an acosia. Enti Yankupon so and said that service ni also produce fluid beer, a friend cervical mucus, and also a queer was say, I was say thin, I was say clear. It shouldn't have any pathological element in there. Send a be penetrable, and because a bit yaman quabo on a day. A jarria film, Nanny Cusiana day, I could dear shemu, Nanny said to me a day, Abba. And it is about so abnormal cervical mucosa, and not to bit me a man sending at the intimate. There's a cervical factor back. Unfortunately, the word I'm going to talk about, and you're common, but a money be also how many pediatrics may produce every be anti-sperm antibodies, or no one pediano, whose sperm now produces soldier for now. Acquire attack sperm now kuno a cool sperms nina that's what we call anti-sperm antibodies. I want to say next cool sperms now sperms and also are the friend and come you couldn't better know womb until the sperms will not become viable. So I want to say next after so that cervical factor now becomes critical. It is so oba infertile. It could be from the ovaries, it could be from the tubes, it could be from the uterus itself, it could be from the cervix, even. So me say cost right because ovaries no question higher centers ovulatory factors like hypothalamic pituitary ovarian axis dysfunction maybe to say ya adwene mu no say because say nyame de no ma bi adua adwene mu a eno nso produce inuro bi ko emogya mu a eno na be sane na be gu ye mogya mu na be minka say be gu nkosua no ho na etime mo no so ya adwuma say na o say ye den on say na sitia no enti sano mo nyina kaboma ovulatory dysfunction, tubal dysfunction, structural anomalies of the uterus, abnormal cervical factors, all of them put together can make a woman infertile. In fact, if you cry common make us say the vagina should be receptive. They should not have any form of sexual dysfunction because a member who has your condition for the vaginismus almost muscles now to me tight into me be my crying day. In this year, Mumpuna Pese, Beman in Huns for Nagunhama, and commonality me a component Kusanade, Akudinsiam. And also, Intino, a mass affirm, Sanoma,
I just said Beman into meaning Shiakra. Yes,
because Sabina Masupane, Husam makes that chemo, but the condition is vaginismus. Now, almost walls become so tight, say it makes penetration a bit difficult and hard for the man. Na se e basa so na se onu ntimi a se bi onko no ho a be de di nso na kogu ba bi o se egu na mposa eden akofra eden akosro ani se bi o menka ne se kusua no akodi nhema manyensia aba enye mankwa so na
okay wo de yen twen ema no yen fisia ne yen kam ma na sa ye beba mema no so echiri ntisane ma we awaken se ni nyina ekabo mu a ene ma ne basa se ba ko pe ena sa so anu so betumi dia
yes on say ubusam say no ma be ne timane ba enye say for some women a man bi ho no ma it could only be a tubal damage one factor a bit many tube ne pe obani bi also could be multiple factors. It could be a tubal factor, it could be ovarian factor, it could be a uterine factor, it could even be cervical factor. What you are saying, the Messi can say, Obu a bit me a dear back open a day, eminent in your day, and you see, Obu also bit me no my abo swing in a mummy no an onion, but Ebi kura me nkase me I'm not exaggerating but ebi ko betimi akoba say oba bia ne tinye betimi ani nyina. I'm yet to see that being in an OBGY unit. But the make me senior and say betimi ba akope e betimi so multiple factors. My boss no my amaka say timi dey infertility eba memo bent. Betimi multiple factors. And betimi so ba akope eni edi nipa ninya. For instance, if you are sebi obi enya ectopia atiase. Ni tube no ni nsɛm sie but answer sɛ nkɔbɛ kɔ tawo die no nkɔtom ne car tube nim wɔnya saa mienu nti yɛtwa ne tubes ne mienu afiri hɔ because a pie na mogya nwunu gu no mu yɛntwa ne yɛnkyekyeɛ a mogya bɛnwunu gu no mu ama no awu nti wɔyɛ bilateral saphenjectomy yɛyi ne druma mienu nyina afiri only tubes purely tubal problem atiase what about obi so you na only uterus only a wodi ekra
ayi so obi sa
yes we be only malaria na genesis obi only uterus ti ono so obe ni den
never sa na no for no bobo
oh sir I don't understand the technical but the whole point is I mean try just be so say you will several things I say obu sa me say nti mu ba kwa na bebre no nti a me so me kasa obu also a bia na ne nkosua no ho atochema ne yaye den yakoyi afiri ho
den e be mana basa den e be na nkosua no
be ebi o ha for instance e bia wonya ovarian ectopic it's sad they're so bad that we don't have a choice than to take out the ovary obu also bia some tumor bia na bibi yare bia beto kosua ni ma bebi otu nkosua ni free ase yanya free wa yare metimi nyina ko nipadua na kwa nyina kra kokuno they say you free ho and several things can cause the ovaries to be taken out. And a man the quite a complex change memano because ocean no mama was ya a man the no a nya dear bacopo if in a woody nano a qua woody animal a conny drew animal a quacum pussy baby or tunkus free. Then you have it me a cause of what infertility in a woman. As far as and also on top of that hypothalamic pituitary ovarian axis dysfunction so another malfunction can also cause that
young come man so
a man so yes you remember yes we DNA on say yes you all be a friend of hypothalamic pituitary testicular axis the chain said yes so sat say man ya adwene mu no ma bi wo ho no ma e be chichin so a na aba na bia be gu sabi ye balls no ye be ma ye testes no na so stimulate na mo na produce nkwamo no sperm no you produce sperm na you will be a friend epididymis na sperm na ko store sperm na maye so it is only oba dinhia mu a na sperm na free epididymis name na fa do be a friend of vast difference na any seminal fluid and seminal for your prostate produce bi nsuo na ye keka bom na be semen no na fi dia fa ye urethra mu urethra na be bia sabi ye ho nsuo no e fa ba if you be manim ba na akọ ene oba na eden akọ ba no na timi ni menka ne say oba no enkwamo no kosua no akohia na nyinsa eden aba na emema de ne group into three ye wo pre-testicular causes ye wo testicular causes and ye wo post-testicular causes ne be chechem de me pese me kanya ne say pre-testicular no normally affect Emma testis nya adequate support sine be ya ebitimi before the testis no pre-testicular event your testis no ebi say obi involved in strenuous exercises, horse riding, motorbiking, or obi so say what a driver otina you can say car otu kwanya otina car mo dibe our long journey. Oh no, all I'm saying is that temperature really affect your sperm production. Some of these guys, temperature becomes a risk factor for them. One of the pre-testicular causes. If we also sabi omonom sabi brain, it's a pre-testicular cause. And sabi brain so nyama bema say intimi mo ma nkwamo ani intimi inform me. If you also are omofa nro bia itimi suppress the production of
just said Ruben
as me specific but me generalize no. You say anabolic steroid.
And only day
a man bu ho I say opeso ye macho na to tablets because they were some of these are drugs which we have to be mindful of when we want to mention. One here, what do you need? So the A2 but no be so to the end normal. But also my talk, maybe some year much to see a palm bo. The most form of tablets were no more day or more fat. Some no need to be affected the ability to produce sperm. And they be also so among so no sabi every hypogonadotropic hypogonadism. I'm saying almost me stand talking about and also make us adwene mu no hypothalamus pituitary gonadal axis also boa me to produce be different testosterone nanka yetimi aboa me ya produce sperm no it's also to touch ma and also can be looked at as a pretesticular factor entimi ma be ma nyinsai oba and you want testicular factors and it sebi testis na nkasa ne ho aka and no testis no ebe produce low quality sperm and as a semen even though ebe nya some sort of good hormonal support near the but still semen e produce no and as a hunsuo na free be ma ne ho ba no ahodi na wo mu ne yeden e wo form and no say se wo nyini a not necessarily aging as a process but when you know it may affect but yeah automatic. 2 yare it me test it is a varicocele hydrocele in so be bigina say be obema bi was me bema ne ba ko ahuna na say ekese. It could be a hydrocele, it could be a varicocele. It can also affect testicular function when it comes to producing sperm. It will also moms on see a na nkwesi akwara ne ha honom se ti mom's viral infection. Yes say and so mass it we say you one treat here. That virus can also, or it's also known to be a testicular cause of what? Infertility. A bit in Bema, see when you've been treating ya, it's also been implicated as a testicular cause of or factor for infertility. It was what more if it be cryptokidism and that's undescended testes. There may be a say, we are for now, you prefer my me. Say, you're sure Mabano. If you're even a besnack or talk. Yeshua sacking him. So along that journey, if something goes wrong, the testes can get stuck along this pathway, either in the inguinal canal, either in the perineum, either in the abdominal cavity, wherever. Along that path now, say if I better honor, be bit me sina and queer, bit me aka. Into Omega say on descendant, and say, and to me, I'm a top baby, I was a day, a better. Remember, I will say free your body never to ask what task and send a beer about control because remember temperature plays a critical role. That's a heat. So what's the deal one? Heat bapa our bontia won't say you and run a kata your boss na day. Name my ha Neboa. Na boss na asanya go from Kama. I walk bapa na folds in a kata na day. Na a taken. Actually, it's a mechanism to make sure that always optimal temperatures are maintained around the testes so that you can produce adequate semen or sperm, in fact sperm, under the right body temperatures. What I say? In Tisadia no so, but unfortunately the testes in the madrona caniyam in sanim begum. That is the condition referred to as cryptokidism or undescended testes. Now, Bema Sabi, or Madraka, Yama produces sperm and no biodine, apodicium, and also can also be a cause of infertility. Anyway, the last part, in fact, even the testicular cause some cancers, and I say some tumors, meaning cancers, per se, tumors or neoplasms of the testes, a bit in so cause say be a testicular factor for infertility. Anyway, post testicular factors. Next, an idea. Or genital system no what produce will be but conduit now the economy. Some conduit that said it could be a problem with Obama, so it could be impotence because at the end of the day, Bema said Bema no baby shiamwa. I was saying called ne soon it could go basi. But said so we said the Bema need to mean peja if there is significant erectile issues and as erectile dysfunction and impotence.
The harder music.
And so you put up say odi ide call. 2 if we premature ejaculation say be your bano or so be man say na when ne ho asane na egu na say e bia ne boxer shorts no ade so only kwan so de gu boxer na nyinsia aba also de gu oba na sense na nyinsia den aba. It can be a post testicular factor. 3, we can have things like hypospadia. The may change say obema bia no sebi ufa obema na no e na ye dwonso fan baby a dwonso fan. That is the urethra meatus opening. Also e ho aso na sebi nsuo no sperm na na semen no sebi ye ho sane ya na se ye gya ye ho a e ho ne faba. Unfortunately ebi mu de be pie wa no ebi mu de ba ase ye shaft sebi ye be ase could be at the it can even come as far as between the base of the penis and the scrotum, pinoscrotal hypospadias. It can be just beneath the shaft. Now say instead of saying car, and there is so fast one say a one no say we shoot to your go straight and I'm a boy. And I say, well, I see how shoot to beko down. It cannot be directed to where it's supposed to be. In fact, even apart from hypospadia, there's a variant of a different epispadia. And the any nias and I was raw. And so since the second baby hano, then so I be P. I say, yes, I know, it need be also a day. It is always our problem. That's why it becomes a post-testicular factor that can cause infertility. Again, you know, I say, can you to yourself, and you can say, Banachi. Remember, unfortunately, we are touching more on say, before I even say that, let me say that, put it in a proper context. For there to be function or appropriate functioning, there should be a convenient structure. What I say, anti-sabi. Ufatu now to say pay our bullet no konenim. And it was a banachi. Finibia with me come up. There's a condition we call retrograde ejaculation. Bemani tutu no. Inse senka in swin be konenim no. Sebi na day. E banachi.
I go even.
The balls in him. So that retrograde ejaculation is also another problem. And it can be looked at as a post-testicular cause of infertility.
It's a pieba.
I said, be in the coin. Into yare no. So, since it didn't become normal one, I'm a become no. When I say yare problem or no. So, since it then also becomes a post-testicular factor for causing what? Infertility in men. Sebi, your average size penis. Sebi, you want to get micro penis. Intimate yashi. Because, no. Ebe sori abe simple na pese atimi akọ ba ho de sabi nkomo akogu mama nyinsa yeden atimi asi awon se tie no enti to sum it up no when you pick up the male factor say mema de intimi ma yanya intimi obema intimi ni ban nyinsa intimi mba. It is these 3 broad categories of factors na maneba: pre-testicular factors, testicular factors, and post-what testicular factors. And sometimes to infections. You're careful. I think say for the sake say your discussion as you soon at the intino. You say it's important say you're in the yare and I say hypocrisy infection is it if it's around our genitals where the common money memenina. You're careful. Because some of the infection can damage us. Some of the infections can really make us pay a huge cost in the near future. Why am I saying this? People have got significantly damaged fallopian tubes. It might be a infection, which is gonorrhea, chlamydial infections. Treating ye, baby basa. Eventually, some infections in a decoma with the enemy. I could say tubes. When you have to do a peba, tubes not safe, intimate washing, also call it IVF. When you get such infections, you have to make sure it's well treated because there's a condition called obstructive exospermia, where a vast difference. Some of these infections can damage it. One treating you can get epididymocarditis from chlamydial infections and gonorrhea. One treating and hospital no papa treating you damage some of these vital structures. Some of these vital structures. To the extent that in the near future, it can affect your fertility. There's some infections too. Apart from mumps virus, these infections too can also be a serious problem for them. And the last one, I think that make a testicular factors, be trauma. So yeah, bema now so we team ebia wo bobo. Ebia wo ye we dia go bia na bibi na bibi bo bema na it is a pain. You have be testicular torsion. I will say quickly. Hospital. It's a pain in Jaco. If there's testicular torsion, that's one do hospital within 4 hours. Near new operation, near Nyeni Yamawa. After 4 hours, you are likely to lose the testes. Now, say you see you be me free while. I see you buy day, you go free hole. wait me produce sperm na dia kunyin ba Debbie. These are all things that you see, but essence be and young huninti yam funny serious, but until a due time you be here, sir, vital structure see. You be here in terms of your see ya worry, you see a insania near the knife, you don't say insania one in the ember, you don't say some casiaba. Na doctor Robert doctor Bishop say sa di we me and some assembly see na BBC am years ago until na akofa sa problem we need abrami. And those are the things that can cause infertility in a man.
Kapital Radio 97.1 FM, the heart of music. Dr. Richmond Amu, KNUST Hospital, and I no teaching komono efa mema ene ma omun to me enwo bema no nkwamwa no nye adwuma oba no nso no nkusua no nso wakani ma bebre. Doc, now I don't know your infertility. You have to be a subfertility. I know minimum ni tree. I don't see ye. Oh,
yeah, subfertility and infertility. Because and they are used synonymously. And I say members use the word interchangeably. I think the subfertility is a more preferred word that these APC use because so her subfertility now it refers more like a decreased ability of the couple to conceive. And there's a sebi and yes, but a brain nenya day, emba momunya day, insane. So it's more like decreased ability to conceive, but it is preferred because when the couple is giving time, maybe you say betting yes. My mama statistics get too heavy. Just to back up why subfertility is also a good terminology. For instance, research actually say so far normal couple biana. A can normal couple or band be a pepe. Them must be a pepe problem be any ho, or when you be any problem. Let's say all things being commitment in say 50% as in a dunum within 1 month to meet men in say. Ofa Busumi Siasiwa, 72%, that's in a duosum, you know, omit men in say.
Kapital Radio.
Ofa 1 year. A more do watching 80% a bit me insane. And at 2 years or more, 90%. In fact, 2 years, 90% of them are likely to get pregnant. What it literally means, they say, giving time, couples who are deemed infertile can get pregnant, can achieve pregnancy. So more or less, subfertility. Factors be brave. And a bit of my bossy, a bit of my boss watch be brave. There will be delays. Some of them, I mean, sometimes.
No, say, yeah, buano, and I know Uncle Sano, why no bit to me a correct.
Yeah, Cassette. Ninsen bar, you should have gone for 1 year. Memory informs me my definition from the beginning. Say, you start here, me defining a time when you dear two infertility, so long as I say, I feel back when I'm a boy. Annie. What I say?
I don't know the time no too so.
It's important because 1 year is and you mean I'm the torso. Yeah, is it it does yeah kind of trick 70 but Cabo who says if you brofun and can make references just to make you understand say bibia make can be a research based a bibia shemu a body and science I mean, it has some data back in it. I just say, yeah, you should remember so say in a tier. Aha. 1 year is the ideal time. To beyond 1 year, no, na feed yeah, I'll see also no, BB 1 year dear is too good, it's too long a time for something for pregnancy to be achieved. It's a problem being how they are. Na feed bit me into that regard.
Into we are problem be any ho. Nanso within 6 months, 7 months, no, so now want to mean any.
Oh, of course. In fact, let me say that.
So almost all right.
Yes, 10%.
Then
I said 10% of infertile cases, 10%. The cause is unknown. You need to cry a man number. Maybe a car for electronics. I don't know. When there's on a lighter note, because Afrotronics, if you have a spiritual bewilderment and but I'm a science person, so maybe they may come here. But 10% you need to cry into couples. A bit to me, a cautious statistics now. Among the cause of infertility, 30% of the causes is attributed to females, 30% to males, 30% both males and females, and 10% unknown. Unexplainable. Why you should be also ye be a comma yet yin signing the ember. Unexplained infertility by day. Sana echere, sana ba. And I think for me, and because any bibia na is your medicine more, you name the credible. There are lots of conditions patients suffer from. If we read the text, because the cause is unknown, and we accept it. And you be a one who are patient be a young fan say 5 years, 10 years, on to be insane. I feel one insane or no, I want to see and also cool baby. You come on, pie man, and also who do snippy and I say, Bibi Sana. Or boy, no, what it be? Oh, yet, you hear, you see, now so my bama, one show woman who say, oh, yeah, send me sharp him for more take a pin for a mission, cook on furniture, make sacco, me medical from a sacco back with convention, make school, a pin for my bin a messiah, and a messiah munti. It's there. It's see, Obia Bawe, dear dance, yes, and now. Okohu dunsini we are so we bonfire man for you say you see one thing I na mempe say metotunase when it comes to matters of faith and medicine almost in the city no yes GDA nipa GDA plays a critical role even when it comes to even recovery and healing of the patient. And to me as a young doctor, I don't underplay, and as I don't really, and ya dear me did me to tuna sakra. Need sending a GDA channel be of Fusa Bagin and Conya. Dear me, may also me as a doctor, de mayor. But also GDA channel say, name harmony dear. Now, meaning say ye GDA faith based, then or ye na en hanunko, han nipedia, community padiana me deal with. So say en hasin like en harmon physical as a me doctor and nipediana physical animation. Okay. Even though I appreciate the fact that my main career is academic. You see, sometimes we tend to think that, and as doctors, we may treat human beings as mechanistic objects. As you shouldn't pass the amount to say if you said you on this Benz, maybe an injector say into Yamfa being show. Now, starting echo, there be panties, or see who's any power emotions. Or see any power feelings or that spiritual being, economic being, is also a social being or a psychological being, on top of it, physical being. They make a say, coupled with what you are saying, say patient never know be catch me say, doctor, even though me ba mo, na ye person mo hwema me nyinse, but me so me ko bo me pa ye bia me boy say nyinse na ba. E kwan nyinse ne fa so ba in terms of on the spiritual side, they mean to me kan kese. But say me hwe no, ama nyinse na gina. Na watimi adan awo jojo ama na ni age na obi ani age no e ho na ye me adan me interest ma no nche so be ka che me se woko ba bi ko bom pan na ko hu dun sni na nyinse na ba e na nyem na me ma nyinse na ko da bi menye sa. That is what I was trying to the point of me to safo no of course say only pa ko na ba ma ye bibia e bia wa hwe no afi ba ko afi mienu o de emfa ne so ma ho afi miensa be ma no oni how bia or checking only how be or banons ni how be which me a catch and say uncle seek spiritual support. Minimum there as part of my training, seeking spiritual interventions. I wasn't taught in medical school to as a part of treatment management for patients. There are always options. Yes. Sir, maybe school got cry out. In my years in school, there was no single time I catch him say patient ba when I say be why ya na nye ya kaso onko sebi dunsini ho na say spiritualist one baby. That is off the record, that's off the books. But maybe behind the scene obi be no ono patient will be betimi no odi nkomo so doctor ye maye bia ti we say me ko bom pa ye ono na suggest ne gidie no opeso okoye o filise beboa no untimi nka say menko anytime can says as long as uhunim say enharm patient ne de faith based de so kaso bekwa untimi nsina no kwan but per the way we manage our patients, spirituality is off the books. There's no medical textbooks I've seen where they've written that as a last resort, refer your patient to go and see a spiritualist. No. And to mean cassette per protocols, but behind the scene, maybe a bit too full, and I've said that faith also plays a vital role when it comes to patient healing and recovery in medicine. Say, as soon as someone says, a bass will be home back to normal for GD any other. I mean, there are times people say, "My main can't some chill." Oh, yeah, Jiao. Oh, person will be about what's a general no. So, a person could free nothing pa. I will say, "Oh, send a coin, send me part chum, person me them in Sacon, a coin da ho." Na me free was a show. What would you know? A be saying, even though a courtesy. Physical, you also need any boom patient because when you saw your doctor, mammy, there be a yenisa. Also ask permission, but it was spiritual meaning too. And your baby and a bit of the side day. I couldn't say so free, even though about also your patient. Oh, but what I say, also me free, I would get an sure I said, Trammy, me call from about. Yahoo, or Coban, and also Doctor Feed and Patrick, kind of bit me day. Aye. What did I make us? Even the wood, yeah, sure, when I'm from with you.
Memma no see be.
I say,
Memma no see be. Said Memma no supervise. I said, oh, shit. On also can say or co wash from
Memma. Said them, we had the same. I'll pay for any show. Maybe can't pay for.
Okay. Now say infertility, dear Memma, I said, and I'm Memma.
No, one. Let me person make it point say.
Okay,
we your bar when you say, you didn't put work and about no crowd in one by session. Memma, who don't say also free na say you would do more so. Okay, also a step point with permission. According to all the needed respect a human being should be given. Even though we're man away. So when him say one ya be a how about crab how know about patient, but also busa. And I'm say no any penny sooner. Yeah, yes, sir. But some of them was step kind of cross me patch my combra. Me co wash my banana me bomi kuna mani answer. You say the intra. Yes, I'm saying.
Say be a hard food do and answer visa.
And yeah, maybe a community.
This is on the lighter note. This is on the lighter note. Yo, yamba in Komoya, where did it? Sanyama way nina waking na ya or say enona a sequine. Your home solution. Nina, your home solution.
Well,
a man at the end first.
Well, and
I say, was our problem now. Move it to me, I share. I hear through how my home woman in saying your mobile phone.
So be a infertile, and I saw baby to me in your bar first in kind.
So what factors be
yeah. So the intervention you give depends on the cause of the infertility. And I say the obayamo bano age na the crudia air cause infertility no. So for instance, obanu kosu atuo mu na say enko year. Na wa yehwe mu nyina no hu say ne droben ne mu da ho. Na wodie ne mu da ho. Na wodie na no ye kama. Bibia e kama but kosu atuo ne enko year. Betimi ama ne nrobia e betimi abo ama ne kosu atuo mu no. Ahoden adan abem. Na watimi adan atokosu papa. Na se bema no so nkwamon bibia pepepa. Ene kosu ne de ahia wanyin sa atimi adan aba. Se ne droben no so na ebia eho aba asema. Eho aba asem no ejina asem kro no eho aba. On se city no enye bibia e beto say for instance a droben ye twa free what say bi onya ectop ne ye twa ba ko free wa. Sa de ye twa free ye de ye twa free ho. On se city no. Se ye twa de mi ba ko we betimi patient body 1 2 awon kora 4. And you don't just see trouble if you want to back with me. Our minimum be our Miyama patient or you talk about the 1 2 baon for I just say something is it. But what about a situation where we destroy a child in your free? Said, Droben in your free or fallopian tubes in your free. ono kra so option say awodie no mu ye kama awodie no ye kama we have another assisted reproductive technologies ebetimi aboa no amana timi ayedai
I don't know
yeah okay said the common thing among for be mama hu de me say me kan ye obi ase IVF am say normally
I don't know the
in vitro fertilization and embryo transfer na say no san okay I'm saying one maybe okay so what we do is that I can say assisted reproductive
intervention na be I don't know
yeah intervention is true there. What it means is that I don't know you be fa oba no ho kusua ni afa bema no sperm outside the bodies, so then you fertilize it.
Into see a trap, how much you try tube na. We don't still a bit to me a form, a bit to me a tune Cusiano.
But say, Drubeni who have from about.
But a bit to me a two.
But into me from Drubeni who general sanity because
Namimi so. Set into your bar, yet trap tube name in a free hole. Now or two Cusiana, says a Cusiano or twice a Cusiano. The American won't the American say a fab baby by now.
There's only one way. Nyame, God,
Yam but me pesa me bisa makamasin. Or two Cusiana. Now when you Cusiana fine.
But
you try to man producing Cusiano.
No, sir, you see the egg is produced from the ovary, not the tube.
97.1 Capital Radio.
Baby a kusiane free bano. Esno ho, and esno baby a drubena kusiane femuno. Baby a kusiane free bano ye freho the structure ni ovary. And the tube na feni fallopian tube na ubi aka fallopian tube no. What you saying? The fallopian tube no na no every be fimbrial end. Ka kusiane release ya na sake.
Didn't you bisa question no? So what say IV say den IV what my friend say
IVF
IVF no obefa oba no kusia na wafa bema no so ne nkwamwa no na me bisa say mu twa tube na odaso to me produce kusia na o produce kusia na man use say kusia na
it stays there ntina me gase na me kan ma me wi anka beti the question ko bi anka unvisa so the long and short of me can say one baby I two kusu free. 2 years say for do be muba. But do ben any ho ye try free. Me say dey e through ectopic immune na ye try free. Until see me say 2 bien ho a otu kusu be from dey akọ. So person ye IVF they can do oocyte retrieval. E betimi akọ baby a two kusu ani free no. Science akọ anymore. And the ultrasound guidance, ye ultrasound ho. Na ye the transvaginal probe near the yo no maybe a de be shower say near amia hukusia no ya dia two screen so na obi kra wo hwe bi oba no hwe bi mo say doctor na se kusia we follicle we the dominant is dominant near ye or sakin kusia na kakra ya ompani ya dia special procedures omo ya obetwin kusia that's oocyte or twin kusia ni we are when before be do one year side for processes more and yes if it preoccupes be don twin kusia atiase nti na me ka be so busa so what is ART no na me ka say ye betwe oba no kosua no ni atwe be man sperm no ni a fertilizing outside the body. So here the key word is the fertilization is taking place outside the body. The gametes are handled outside the body. Sperm and any kosua nyina eba ye wia na ye fertilizing the carbon wia e wo lab and I say what test tube man na feed it me form embryo na say moja to na ni assign if embryo transfer na feed dey abeto awodie ni kisa awodie ni bibia pepepa as in usi akwan bia ni awodie ni endrana wa awodie ni in terms of the endometrial capacity no so ye kama na de beto awodie ni ma I was saying insanity me grow with some good luteal support and no crown yeah no san say nyinsan na kwan fast for buy no anya natural way ninti normally if be corpus luteum be produce progesterone and kama nyinsanati mi agina yeah be sa ma sa progesterone abonten dia na se ne mpane na etimi ma nyinsana eden agina kama nanka akona ni manu etimi eden awo onti na sitia no nti ye ga se ART assisted reproductive technology ye kanya ne se ye fa oba no kosua ne afa bema no enkwamo no na ya de share mu outside the body outside the woman nyina nyu obi body mu on se na sitian yivia na de adan de ato oba na wodi anim ne amani no na amanyi se na gina na akora na timi awunyini no why de no ma wo. You have a lot of fertility centers for Kumasi or Muyesa no man be bro.
A wonder from there.
Sorry. A bonnet that from a relative. It's a bit I don't say Snobia be a me abia your funny permian any beach now.
Oh dear, oh dear.
Oh
both young fans.
Oh the average Ghanaian. The average Ghanaian
20,000.
Debbie a brosa
40,000. 50,000. 60,000.
But it's a bit expensive. I know, say, I'm sure it's center dependent. Baby, but I'm sure say it's ranging from about 40,000 to about 70,000. So, 400 million. It could see 700 million. I'm sure. But I'm sure say to be within that range for babies. Maybe no more to go.
Capital Radio 97.1 FM, the heart of music. Mikaimo said, moment of awakening na uti. Na Dr. Richmond Amo or no na yene no chiche say oba betumi enyin say anasa bema so betumi ne nkwamo ano emu betumi aye kama on betumi awo. Me acknowledge my sponsors abasesia.
Very good. G, great performance. L, long lasting. That's VGL.
We want some demo. We can full VGL motorbike amount and anti-kama fuel consumption. Jet VGL aboboya ewa huodin etumi before any load bia. VGL more durable tires. Akesia pa the Caterpillar tires. Articulator any nketwa and sanso enwintem in slow load bia metre suitable for all terrains. VGL pure virgin premium lubricant to set engine oil, hydraulic oil, any gear oil, specially formulated for peak performance. O engine besu kama no fitamubia. VGL batteries also a powerful, reliable and strong. No yempia. After 6-7 so 8 VGL Yama a to 4 Fred 0243 67 5020 Kumasi Alaba and Crime Caprice anywhere VGL Ejatuatua Ejadum
Long lasting. That's VGL.
Yo VGL for na omode program we ebre nene ye twetwe awo ho enkomo ye twetwe awo ho enkomo sani abefa akwan abefa so abetumi anyinsen. Yo Dr. Richmond Amu die na ememanum bi ye enemanum bi nso womo ye en sene fatana oboboso me pese wo to oboase na ukom ye mayen
say question not like a question bit me about BMI.
My question no o de nya botre Uprise Health Shop ono de or the WhatsApp or say those with collapsed fallopian tubes, how do they menstruate? Also, bisa was a question. Bisa was a question.
How do they menstruate?
No. Media send me bisa no bisa senti no omo tu kusiana say kusiana say when you su kusiana say kusiano
so answer yes time se minutes one year start here. On the time said the very
me patcho your phone numbers near 05 me a phone line here. Me a phone line here. But obetumi send a WhatsApp message about 0557 52 22 13 and our text message 0557 52 22 13. Obetumi send bisa o asen BBC bia obetumi bisa no Facebook, obetumi bisa no YouTube, maybe sa Dr. Mam. Yo.
So once I start in the day normal cycle of the menstruation start here. Because I menstruation you have 4 phases. You have the menstrual phase now, because where the bleeding actually is, and then it about 3 to 7 days for every woman. And I'm a cancer, there's a correspond once or bleeding up, na baby and there's a corresponding change in the ovaries. It's also going through follicular recruitment, maturation, and growth near there, so that the American say ovary nimon baby able to say. Now you want to start me now, so start to recruit if it be antra follicles. I be more benyini, almost benyini a name bako. I'm a kusuya kese bako bet me. So be a pepa. Now say ovary no, release ovary now for tube now banana set me taking place. And no be kwa see the follicular phase will go up to about the 13th day. Then on the 14th day, you have the ovulation. That's the ovulation phase. So about 2 kusiano. What you say about 2 kusiana? And also we have be luteinizing hormone search. And never more kusiana there about boom. 2 kusiana. We release kusiana we na kwa wodi enim na. Wo baby out 2 kusiana free and your free be dominant follicle. And the 2 kusiana and na kusiana free mobile. What you say? Now, for me, be a friend of corpus luteum. Corpus luteum will be produced be a friend of progesterone. And then, so I started prepare. I would in him. Oh, in Drana, son would in him, and then endometrium. It will make it go through what we call secretory changes, so that it will more or less like prepare. Now, as a new sincere. New senate me there. I be 2 months where they atono kama. But say Kusiano is a new sincere. What it means is that the corpus luteum will degenerate. Oh no, ebe my main kind is another different corpus albicans. Once a woo president, it means that there is no progesterone support for the endometrium. There's endometrium no. The man in come na prepare no come train say and can you say beba na bibia betom no. What I say? Enti mi amasa nintino. Then ne say no yeden echo. It will be shed again as a menses, and that's what some people call, on a lighter note, the bloody tears of a disappointed ovum. That is menstruation. They just say in Geranimuno, I break it down. I say that process not say I started to use that to answer the question. No? That process, whether the tubes are there or not, will keep going on because it's a matter of ovarian changes coupled with endometrial changes that brings about the menstruation. The tube it only becomes a conduit. But yeah, a kwanya kusia any nkomwa a bit made a first question and you see a take place. Now boy man you say na take place na day abeta with you. But menstruation is a matter of higher centers, hypothalamus, pituitary, ovarian, and endometrial changes. That's all. But what I say? Until answer I don't know question beside.
Until bet me to kusiano all right. But I never wait na NC.
Say you say be amba. Beside abesna
into the yet no
and also I said tube it doesn't play any part in the once a process na me boy no. The menstrual phase is the shedding of the endometrium. The follicular phase takes place in the ovary itself. Baby, I took you free, no, isn't it? The ovulation phase also takes place in the ovary itself. When you took you free, isn't it? The luteal phase takes place in the uterine cavity, the endometrium, because you produce your corpus luteum, produce progesterone. It acts on the endometrium to make it grow beautifully, so that I can accept a pregnancy. But what you say? And he said, tube nimbe baby ao. Do they try tube in trial? Those changes are going on, and the patient will continue to what? Menstruate till they get menopausal. Unless you're out free. What I say?
Matthias here.
Menstruation in any is a pure hypothalamic pituitary ovarian axis activity coupled with changes in the endometrium.
Thank you. 7 minutes to 7, Kapital Radio 97.1 FM. A moment of awakening now. Asugusua Utieno. Doc.
Yes, sir.
Sesia no when you are touching komoi. Say sanima we na nesisi na emma bema ontumi enwo emma oba anonso entumi ngu. Lifestyle being say pathological causes ni sane mani nyina wa kakani nyina the lifestyle being and na wo opesi ye live a si opesi ye wo e be guarantee
sorry mema first and I say ma so oba me code the hammer mo fan chemeti for
no ma
oba me start me can say cervical factors can be a critical thing when they about so oba cervical I would no on say na maybe of wa mo tanya infections especially chlamydial infections gonorrhea onya ye na ne sebi because of say ye advert be radio near the obias nedrosa gono obias nedrosa your friend say chlamydia obias ned white bia you gono ni na de now people are treating and taking some means say obi adwuma there but what I'm saying is that unya such infections especially so your about reproductive years Bra hospital ni show ye because there are important investigations test a bit in ya a bit me hu aboa property e cause sa infection and yama we bit me treaty na one but now so ano a someone bit me nyini akwa wodie nim e didi akwa akose with tubes no. And how do you get these infections? Through promiscuous sexual lifestyles. And I say promiscuous lifestyle, I say ufriha no akosia ufriha no akosia. You stand a higher risk of getting these infections because they are sexually transmitted infections though. Oh no. It is all your bar also to make you free no man. Two. Enro no basa. Because medical can say enro bu ho no ma intimi ma yonkosu atomu kra nya dai. Enkoye. Oh no. Inti anu nso so o se dai. Ye careful. Our sadian. 3. Smoking. Alcohol, especially smoking for women. So smoking so beti me ama ushi cigarette ni adia. It can also increase your risk of becoming infertile. But I say, and also no for the sake of education.
Smoking or how?
We can say cigarette smoking.
How does it affect?
In fact, it's one of the things that can affect. Because nicotine and as almost smoking, one of the things that can affect almost every single structure in the human body in an adverse way. The smoking is dangerous. It can cause a lot of problems for the human body. From utikosu unasi, almost like every structure in the body can suffer from the effect of smoking these substances, nicotine, and as a tobacco and no. Smoking, to cut a long story short, is also a dangerous thing that can also affect your fertility. And abuse of alcohol, prolonged use and abuse of what? Alcohol. It can also cut down on fertility. In fact, where the kama both a bar any day in Beamanina, Mekama.
Now, abortions in Sway.
Mekaba. Abortions. So, abortions, and you move a wood woman. You was the Noah Babesinico. Spontaneous abortion when you control be also. I say, and I bet in the Bassa hospital. Now, the young scan here said, the Akamuno, a dose one, ye piano and every one, the amount until it's be a unya infection be after the abortion. And yeah, what induced abortion as a termination of pregnancy. Only the Oma or no one in or name save your own opinions and it's a hospital and I be a ye nafa counseling money fa kwan papa so omo ye free ho amano no ad nepe akoto adura so bi amane do dia hye na sia na ne baby no onom na afi da be septic as say e baby a di akamu no and so the wobbling you so okay it may ye infected na bon na afi dia started the konemojanim infection no konemojanim what I say that's what I mean by they become septic like septic abortion. So when that's omo is seriously infected, omo hospital. One son say it did no could be a friend septicemia. One you careful, a bit me come quick. But I say, and 2 abortion
septicemia naturally
infection of the blood. Yeah, chin
Papa Mubu, what they make treat their own to me in Kawan where the explanation. Okay, so
okay, abortion. Call ye no, if free honor. And yes, we are or see a more antibiotics a bomb by an untimina infection beer. Best and so on 1 year nadient. No name say also you're protecting against infection from the abortion. I was a man prophylactic antibiotics. And I say antibiotics ever born in rebel no free infection. Where you be one fat. Na kakrana akamundi akanaseno. Are you infected? And why I can say infected, yeah, so otiasie na start a pro almost was in sufin in su kankan ne moja sufin yeden egumi firi ase ba na me ho ayehyehyehye abode betias wo twahwe hona na say infection did di koni moja mu so it did koni moja na say they can go into what we call septic shock and I make say it did koni moja mu a wonya obetumi septicemia na we go into septic shock I say the blood pressure beba from the pulse
Capital Radio 97.1 FM so na wutie abo nonson
apart from so sa abortion ya also call hospital near ma onko no de akofa fikyire bi na obi di bibia kohye na no de ya wona mese mia ye ho bi pen oh memodi ba esi your baby na mo de nipa ne ba konfo no kye ye operation man no obi eso ya abortion ma obi o ye chokrodo za wo dia wa wo die nim so there's what called uterine perforation ade ko dia wa wo die nim ma na ko twini pa no nso no nipa no nso wo se akora na black accord neighbor but don't realize na ma na a pass out ama sebi ejana nyina fi na se ba na fi no mo rush ne ba konfa no chi otete nso no nyina die na bese meka at that point wa say wo die no oba wo se ya wo die ni free ho ye nyi a obewu ti die na wo se wo ye our send there's a untimi repair uterus no we uterus ni we are what I say donc we uterus ni we are obetimi nyinsa bi mana tabi isi adi konfono eje o enjin pa o gini pa nkwa bebre pa doing extremely well because so no ma bia ye hu no de bi no ma bia sisi baby a o mo rush mo ba ho no these are all consequences. When you walk yes abortion, I say when you uterine perforation, not say I said that say yeah you are there now obewa. You be at least otiasi now ni ba cross better. Until they making yes say oh sa yes abortion, abortion na say one you kwa pass no one ko be papa bit me ama year. E bit me say wa wo there na ma fidi ye ni choice o say you are wo there na no so bit me say what is obi oni a wo there 20 me dey enyin say no dey. Wow. They no sa no the only thing I want say obepe oba foforo na bia ifa okosua na afa okunu no enkom na de ahyiam na de akoto sa oba no awodi ma mo na ife surrogacy no
tiremu
surrogate mother say afa oba no okosua eni afa okunu sperm eni ya fertilize wo test tube yewi ana baby na afa mo no de akoto obi awodi mama wo
obi foforo oba foforo
that's a surrogate mother na make a surrogate mother no then tin de na de ya okunu sperm no okosua na ba oba foforo na beda na yam one hour ebia baba jimoba
eruso boy say
any minimum ne boy these things I spend you can is any boy then papa you can imagine ne boy then so nti ewo insunsanso bebre but until say we be do that stage I say ebia say bi waware o peba no e da bon say sa no ma we ya boboso yi aye no ma tra ya fa ne tra no with serious implications on your brabo as nipa and on us as young kasa so your future with regards to your person nya a man na say nkwara away nchen
yo to aswe and some be our lifestyle na out na me dey abortion be shame
and na ti and a mema so the same then na makabia ma mema na ma so ensa bebre smoking I don't say na city
na mema nso ahia adware nso so say ya de na hia hitu
I mean persistent prolonged exposure to heat then am kasa da be dware nso hia kra hu se wa de no ebobo na apagya ne ko ana meboa
o say so hia Canada ya sane eyenua
ebobo na kama na nti on the self control no ho de a only problem but you can in a situation where we be baby and nipa ye adwuma no or high temperature prone environment it can affect it and as will be otenase chair or drive from maybe a Accra Ibia to Burkina Faso no break straight me the cancer more high temperatures ubia or you involved in strenuous bike riding, horse riding, those strenuous activities, all of them stand the risk of raising those.
Obama she mu no betumi ade infertility aba oba no so say be man na ade no ekowo baby and I know the Debbie.
Ade we inquire.
I didn't mean
Debbie. No, there's no end there. Sa na design no. Enti sa na o say so ye na say ye dia. Na de ko baby o say ko dia. Inso so boni bia ma. Eso say de kura ye de mu baby ama na timi contain.
Yo, make I must say phone line here 0557 52 22 13 0557 52 22 13. Wait me send a WhatsApp. Say want to me and run so I'll bet me a voice note. The abre we me voice note mebo na Dr. Ayi Wano. That is for WhatsApp messages. Mamin ko papa no osan bi say bi mo say okay. Role bay and a herbal medicine a play infertility. Not even just herbal medicine, but medicines and kasa. In Ruby or why a bit me a man na ye infertile and a bit me a obana ye infertile. And I was a woman also no be
yeah, me can say there are some drugs. When you take them, for instance, Bema. There are certain medication because anabolic steroids. Obi also be so macho. Into your tablets be a omo for manim. Omo fa it me bo muscles near day. Eba akese. But remember say we introduce exogenous steroids into the body. Into be suppress our body ability to produce the natural one our body nimlet me year juma years where my test is not responding well. I know you will no be a swan casaswa, for instance, and also to me can be bored over Majai, and also to me, Emma spermatogenesis as a intake play. You can say, I won't say, send your own common or produce. In Rubu of far a 6-hour process, no crime.
Almost say diabetes a drone.
No.
Na pressure so a drone.
No, but it's a drop our core meaning say, yes, I know, not say Muji Minugu be a more. If I'm cimetidine, and the doctor and trauma could tell me to say market so, and we can inhibit spermatogenesis. I just say, again, you will other drugs. I mean, me body. So for salax and pneumonia, and a work will go through chemotherapy. Also, when your cancer be. Now you treat as one of the side effects of the medications. Some of the youngsters are in running the treated cancer, chemotherapy. They do one inhibit cell growth. Cells be of course will multiply sperm. You see, a bit me inhibit those processes from the ovaries and also in the testes. What I said, and also bit me affect fertility. Also a bit me a pelvic irradiation. Like I say, hospital. Maybe or some form of cancer be on na yase I mean can say na you can you be a you bet be a shit sa cancer cells no sa e wo say a shit cancer cells no but one hwe yesu sa normal cells na and then so where yase e ho na ye ovaries one ya de no e bet me eden ahye no so part of it and I say bet me akoka no and so nya sa and losing the ability to multiply and really do what it's supposed to do in the manner was say that's what I say. Coming back to another question earlier, say herbal medicine. What role do herbal medicines have to play when it comes to fertility? I will say this. Yantias say normally fertility bano. Your structural causes and your physiological causes.
Structural causes.
Structure need to say. Once make bubbles make can say we need tubes. We need tubes na say. Ubu na wodi no fibroid kese eden edem ubu odi na wodi no fibroid na edem ne akama na eden esi ti the only way obetimi aboa sa nipa no ene si be yi fibroid na through operation na wodi na mu eden etimi eden ada ho na bi anyinsa na etimi eden aba ati ase o kan say abortion me refi o kan imagine you free bi Asherman syndrome ubu ho wa ya abortion santi wo kwa ne yadwina wodie ne mu santi nwira na esa na wodie ne mu no yadwia ma na nyina sa aka scar kro wa the scar no kutwa
okay
and it was even Asherman syndrome. What I say, such a person you need special care to be able to. There's a normal bit me ama sani pasano aboa ayi sa scar na fro na mama ne bit me ama grow me can be see asem so obi of fibroid kese obi hia surgery to take out the fibroid what you say obi e bi owo ovarian cyst bi ana cause problems ana bi bi nipa no there are things we can do to help the patient. In other words, most of the structural problems I know man because of say structure no who I say bibi say mama fa fibroid na easy for me be here operation no untimi nka say o command nipa no say bi herbal medicine no one mama fibroid na den anane na watimi den anyinsen. But I've also known, I've read literature, I've read documents, scientific documents. Herbal medicines have been used to improve hormonal function in women, for which reason medicine is insane. And if it's probably a hormonal problem, hormones maybe no maybe to tow ye. And as I say, normally I don't normally want to use the term hormonal imbalance, but regardless, for the sake of your discussion, if your hormones are imbalanced, I mean herbal medicines are fine. Some of them have fine ability to regulate hormones. You beat me mobano say structure be a fine, na be a pepper. You beat me a boy, I may be a hormones. Na
did the person can say baby drono and to mean correctly any structural dysfunction?
Yes, so you have to be careful when you are giving it for structural problems, anatomical challenges.
To me correct it.
That's why I said structures. We use some of them will need surgery.
Okay.
What you say? And them kind of structure, anatomical problems. What you say? So we will septate uterus. I wouldn't match it to a drobian one man. Oben my ben. I say operation. It me the achemuni free ho. Ne muda ho na yin centimeter eba. What you say?
So be a fibroid. A drobian no be to me anane no.
Depends on the size. And no crano says so I drone anane no. And you say anane say I'm on free ho crowd. The best thing you can do for your patient is to be able to know the size of fibroid. Be me ask as this a fibroid. It be me like say me say fibroid. What you say? It depends on the size, and it depends on baby. Also make can me check say oh baby who do na ya obenya fibroid no. Your submucosal, your intramural, your subserosal, your pedunculated. Enti ni nyina fibroid too, but ni nyina approach it different. Ni nyina so you worry about as doctors. What you say? But said that would name amoje tour. And I say my would uterus no muscle nim na say ma wo moje tu ni pana na say ma ne pin na ma ne ntimi nyinsa na say ma ne nyinsa bo ma ne nyinsa ne ngina
dear na the fibroid ne ba open.
The causes on no say me catch or say there are several things in medicine we don't know the exact cause, but we know is that it's an estrogen dependent
estrogen
hormone. Hormone
she know descriptive over to me as describe you better
say no man bia you produce call body tunkosua ye oba say obenyin in a free chrome has no infertility no so it's one of those hormones. What you say but fibroids no so also it depending on it to grow but the exact cause is not really known. But estrogen, because estrogen responsive hormone, I mean benign tumor. I say a tumor chronic trees idea.
Okay. Mr. Asempa, Mr. Asempa say, I didn't know man now more in me be no, omo bre and san no many saying, or say a man now more in me be no more bread, almost sign was a nuna, a wooden pedrian, I'm a friend hormone, hormone infertility balance or said the imbalance. Why?
Yeah. So what that is classically describes what we call polycystic. Would be a friend of polycystic ovarian syndrome. Okay, you go through here now. But who say okay, be back? Polycystic ovarian syndrome.
You go through the.
Oh, make us see. I'm saying, ma, now let's be an ocean.
Oh,
it's okay. I mean, so Omono will be a friend of police, but what me?
Yeah.
Omono androgen estrogen imbalance. Dem be say Kenyan say, on so baby ano. Be ma hu kakra wo mu. E na oba so de wo ho. bema so a body kakra ho and a bema de ho mema dominant hormone and I say kaso hormone I say di akotene pa but what me e di akotene pa yi mu androgens, that's the predominant one is testosterone. And mass hormone di akotene pa wo mu estrogen. And mom curves, so almost sending who buys it, but it's one of the predominant hormones and so decide you man. Now bema kakra or what but there should be that situation where Obani the NBD Bema Nidian so no Obani ye Bema de Mus or Baka Cradi or what but there should be a situation Bema the NBD Bema no so not what who Bema ye. But in some women there's an imbalance in that androgen and estrogen, you know. What you see, and more or less I had to say the Bema the any day a costro into being features of a man. And then now Obons in the Nimuni Funi, you know, your friend Hesutism. Obos of a catch or say acne abamanim bebre obu also be catch us when typical male hair pattern distribution or bow as was me fu about you say me pampa mu ye den pa what you say obu also me boso ye den afumi and I say I be as a pimples ohunu egugu manim ne me ye den me boso afiko dem me menses nye den emma what you say ebi are irregular ebi are 3-4 months me menses crying day embada. All of them are features of PCOS, polycystic ovarian syndrome, because of because of androgen estrogen imbalance. I want to say all these are huge topics on their own, but every piece say now.
It's a pathology. I don't know pathological.
Oh, I can't polycystic ovarian. I don't see one of those hormonal imbalances now. That takes place and
anatomic area waka.
I'm a Canada.
And the pathology hair no animal to fall under the pathological.
Yeah.
And
say I mean per the question I'll be signing there.
No, but if there are other pathological causes.
Oh, but mention me brave. Man can be brave. I'm said me started
work on investigations and this is your investigations.
Young kind investigations.
Young investigations and your brain.
So investigations, you know. What's your banner? Over so who the problem neighbor. Is it a problem with a hormones? As America says, is it a physiological or hormonal problem? And I say, is it a structural problem? So what do we do? Say hormonal problem. Then a be investigation. You be different serum reproductive hormone profile. You be share the hormones. Then you be follicle stimulating hormone, luteinizing hormone, levels of progesterone, prolactin. You be say sound hormone in the lab. You be in area. Ni I say e mu die hin na hwan den atochema. Na die ni betimi aboa. Ayama na betimi aden. A reverse se na bia obetimi resume the normal menses ovulation no betimi anyensen. So for instance, ebia na see or high levels of prolactin. Prolactin so na ye e ma o manyensen o ma wo a o mo manofo no ene ma mutimi produce breast milk. O mo produce ene so e ma won tokusua. So more or less it inhibits ovulation.
Okay.
And if so high levels of prolactin, you will dread bemana. Prolactin level na dey above form. No etimi resume in menses, then they can now ovulate. Na se bema no so bibia pepepa. What meaning ne bema ne dey share mo anyi se etimi dey aba no ho. And I say issues with this fibroids na what awodi anima. No be here surgery. E be prepare no. Near your operation near you fibroid na free. Awodi anim. Na kwa bedem, na kwa ni mada ho. Awodi ani ekru ni wu kama na bibia kama. Na nyi se etimi dey aba. Na issue with ovulation so ankasa se bia kosua tum ni mayemra e bit me ovulatory induction e bit me amane no bit me stimulating ovaries no na amane timi eden atukosua na nso ne be man ho kwamwa ne koshia na nyinsa na eden etimi aba se bibi na wa wodi nim na intimi manyinsa ne intimi ba for instance endometrial polyp be polyp and a da wodi nim a e bit me a polypectomy e beji polyp na free na wodi enim na kwan na eden emobie na nyinsa no kroni wu a na nyinsa etimi eden aba on se nesiti no se ye tube so a ye be hwese tube no ye wo test bi ye be pompe edrobia for wodi enim na ye twa x-ray na ye hwese droban ne mu da ho a ana mfriend HSG no hysterossalpingography ti no se an ye pompe fema na ye be hu sa wodi enu so benya wodi no drobeno fallopian tubes ne mu da ho anase mu asisi a eno so yeden yebehu eno kra de sa of another advantage apart from say Emma who say drobeno mu da ho no as in the patency of the tubes no, it also helps you to know whether they are intracavitatory anomalies. In fact, I would any mono say no so be a touchma woman or any distortions in the cavity, in the uterine cavity. I was in a city, and you know, a man else me quite me to work, and the idea they be share machine a pumpy a droby friend you try me actually. We will know all that. So if there's a problem there, and also so based on that, then we take a decision.
Yep.
And the investigation will be determined by the history from the patient and why what you are thinking is the probable cause of the infertility. Then you target your investigations in that area to confirm or refute it.
Yeah. 0557 52 22 13 0557 52 22 13 or assembly apese ubisa doctor na wafre needing the doctor Richmond Amu or Confanoche or Sanso or KNUST Hospital 0557 52 22 13 maybe a phone lines no atum wa assembly apese ubisana ubetumi bisano ubi you no pepe 0557 52 22 13 ene ye ka infertility ho asem nti opanyini nti oba enu bebre wo mo no mo ntara nyama asa ho
onye omunyi depends on baby anwini wo
baby anwini what is that.
Oh, now I'm going to go about you. So, about you say your friend has sutism. Very
hello. Yes, opinion name, Mojo.
Yeah.
Oh, yeah.
Boko,
you're frozen. What are you? Opoko, free.
You free, I'll go.
I go, you yet you.
But oh, this visa doctor say so. Obama, I'm not. And also this year, the cyclone. Come out this year. I want a paper, and I want an intimate.
You person a brea only or banishia, or bet you been insane.
Anytime in I need anymore.
Anytime I only share needs a number. Ayo, Mate. Open set time I only or banishia needs a number. I don't know.
Anytime I say back.
Okay, anytime as I say ba. Yo, Mate. Yo. Eh, afete obi aka mo ate ana.
Yeah, Mate.
Why na kan ma ate? Oh, yeah, doctor.
The pattern.
Doctor na kan say me doctor bay.
Whatever.
Yeah, friend say hospital bay. Anyway, this guy is over here, the doctor. Mr. Wadaro, Miss I mean, two way video. Hello. Mete nka wo phone mu na won kasa me yente. Okay. On kasa nti 0557 52 22 13 0557 52 22 13. Anyway, masturbation for trauma me na ya no ina no. 0557 52 22 13 0557 52 22 13 and no infertility ho asem ne kan emema ene emma ade nyina na ye ka ho asem no nti wo asem bia opese wo bisa doctor na wa bisa se bibi ha wadwen a ana bibi a ye kan ya wante ase a na wa bisa hello pacho metimi nka wo njo radio no kakra ma me wase
pacho obi a wa ya
pacho ye froze wadaruma
obi FM kokudia wo kwada so
yo yetiu
obi wo fibroid wa adu be 40 to 45 wa adi wo mutuni for
obi se we di 45 years I know fibroid o mutumi aye free ho yo mate me pacho osi obi di 45 no fibroid o mutumi aye free ho o di tro ni nyina na obeyi ano baako 0557 pacho munya botre mu amode question na ba no munya botre ye be churo ni nyina gu ho Dr. Biyano 0557 522213 0557 522213. Hello. Hello.
Hello.
It's your woman.
Yeah, good evening, boss.
Yeah, you're frozen.
Jay, I can say, I don't say maybe dog the woman. Everyone said I don't forget. My man office order.
Sir, was this you?
Yeah, no, good evening.
Good evening.
Yeah, no, I mean, this DJ, you see, I make time for your program.
Your body call, eh?
Yeah, I beg. Now the question regarding about fibroid. Is it possible say we do a fibroid or to be fair in say and I say?
Yo, what?
Let's say maybe say we do a fibroid. You fair in say yeah say.
Yo, Mate, obey you one.
The question I don't know.
Yo, Jay, you that's it.
All right.
Thank you too. 0557 057 522213 0557 522213. Okay. Hello. Hello.
Hello.
Yamawaju Ominia.
Good evening.
Your fro say Wadaroma.
But
your fro say
me see about me cares about.
Yo mehu kasa
awon kwei na kwei na nyini I want to watch a and na so no biawo
o say ni senior brother e won kwei
I want to watch
brofo no your friend is enkra henia o say why dey
I'm not sure I can say and or no baby awo na abusafa be so say it's not an queen in a bear man. To be some say, and quit towers with him, maybe a low sperm count and answer infertility.
Yo, yeah, that's it. Minia. Yeah, that's it. Doc, watch it. Watch it. Very interesting questions. 0557. Hello. Hello. Yeah, Mawaju Ominia. Yeah, you're frozen. Wadaroma.
I maybe a jam Casafi Dicamso.
A jar Dicamso, yet you.
You now, so we can and maybe it's the same will be cafe. One in the Kuno is Yama. Was sorry, I'm not. And it's you not and I'm a case now. It is our problem, no. A man, we talk and answer a Yabano, and a cabin and also a man bata.
Yo, yeah, that's it. Doc, what's the question? Aha, I'll say, Bearman who so no etene, a free Obano. Okay. Hello?
Hello, good evening.
Yeah, what to say?
You are them now, say.
Yeah, who ya pa?
I could see me and Mikasi and Omato.
You could see it you.
You say, your say, about it to me more. I'm to me gay, them and to no my day or baffle for me to at their comma or body. You didn't say, man, you are only something to eat in my farm. And dear, let me then our command. A bit me, I use you want to man.
I mean, yes, yet.
You see, what can I say? Of them or body, we are boys in our war. It's really a them and to queen to yet your comma or baffle for. I'm an onion. I don't mean to say or baffle for naturally or new yet. Any didn't send a command into almonds 18 for one.
Yo. Mate wasem no. Mate asie. Maybe san why? Yeah. Okay. Doc. Pacho what running na? Okay. Pick it. Okay. Hello? Man, I feel about where?
Yeah, now swear.
Me who ya? I don't watch us. I guess so better than that. I'm a member na diaboso. Your fro say what that Roma.
Yes, friend, I can be stressful for Naja.
Yet you.
Lakeside.
Yet you.
Miss A. First blood, no. It's me one a person. Oma in the Christians. Na, and no, a dear.
Mantin you.
Miss A. First blood, no, my in a panamiensa, or my in a miensa. Na, a dear, at me basa.
Dear, no, my enemy answer.
First blood, no, my, you know.
Right, okay. Also, my enemy and so on.
Yes.
Ain't he?
No, hello?
Yet you?
No, I know, occasional my enemy and see us in the first I can see. Mukasa, Basaya, and you.
And to be said, hey, Nelson, so Bonnie, as well.
Me, Busa said, didn't let me basa.
Didn't let me basa. So my fiber now, as I be on the fuel, because it didn't let me basa. Yo, Mate. Some questions need also. Yeah, Brennan, so, yeah, Mama doctor, Antonio Boas, no new questions, Nina. Okay, what do you pick it? Last one. Hello? Yamawa do mean you froze. Yo, it's you, Minia.
Better be bitter, doctor said. Obi wo blood pressure. What me wanna?
Yo, Yate. The bizarre question, the blood pressure, bet to me awa. Yo, Mate. Watch it up. Be one. Me pa mo chomi fa ko bia biom mama doctor any questions ni nyina no questions na adoso besira mo a doc.
Yes sir.
Over to you one by one.
Nti we busa say sorry time ben na oba cycle oni ni hia o say nyinsent mi ba
ana say nyinsen emma obisa tu
say basically who answer nyinsen de na the others ni nyina ye free
yo.
Nti the ideal cycle length no 28 days plus or minus 7 days. In fact, the normal range is 21 to 35 days, but we always use the 28 days in a cycle. And for a 28-day cycle, day one, the phase the band also bleeding. Phase the bone menses. We are likely to ovulate on day 14 into count 1 from the phase of homogeno. So the 14th day is the 14th day in an ideal setting 28-day cycle. No, I want to be day. Only the day shemwa needs a bit me day. I take place. What it literally means is that any other day apart from the day of ovulation, because of otukosuana, the egg has a maximum of 24 hours to remain viable. The next is about tukosuya. It took 24 hours, but the egg ceases to be viable. Intimate insebium T. Intimate NF. It cannot be fertilized. Okay. What it also means is that among all the 30 days, there's only one day, penano beshi or betime day, and that is the day or day or tukusiano, which is the 14th day in an ideal 28-day cycle. Apart from all other days. Now say because so a day 3 days. Yeah, I'm coming to that. Okay. But at the end of the day, the reason why Bema should survive even for 3 days, one is because I want to say na make us say me more definition. Me say oba any bema they should have had sex at least 3 to 4 times in a week. And that 3 to 4 and you continue so it is done in alternate days. Okay. Be an omodin shemwa. Why? Because of the same reason I say about how many days? 3 days. So that if it's done in alternate days, there is always a fresh sperm available say be oba no to kosuane e be den e be chi kosuane nyinsan den atimi aba. So that is why ideally you should have that, and it should be done in an alternate day. But kosuane dey 24 hours.
Until with this case near fa madwa 3 days no ban 1 day. Day bena on oba shia
14th day of the cycle na maka no. Until 14th day no on kind first day from the day oba no hu ne moja no. Ati I say enkosi 14 day 28 day cycle, that's the most likely period about oba man be dey. Ebe oba no ebe to kosuane ne hia nyinsa be dey ebe timi aba. Any other day is free period.
Okay, next question.
And the next one say masturbation bet me akosi.
Na botre inti no say inti 14th day no na say be man dey na di 3 days so on that on the 12th day e betumi achi oba no because the man dey go ni mu 12th day
so yes
13th 14th no
I na make anti alternate days
and say 13th day you safe 12th day you safe.
No, we are talking about oba no. I think the question was time when oba no fertile to get pregnant.
Okay.
That is how I understood the question.
That's all you be man so no be so benin so oba no na abortion.
It means that then what you are saying comes in. On function team say ni kwon no be 3 days oba no mu. Enti sa 12, 13, 14 no. Onye day, ontwe ho.
Okay. That's it. Next one
I say can masturbation cause infertility?
Yeah.
No. A big no.
Okay.
And I did.
Okay,
even cry no. Say Bema yes suspect say Bema or you treat couples for infertility. Na say say ye testimony. One of the ways a beji sample from a Bema no or collab or Bema in common no and I say the sperm no, on the semen no is through masturbation.
Okay.
Is the most I mean that's one of the commonest things we do in all the labs. Bema no masturbate no one just sample no. So it's a big no. And I'll be say can you beat me a fibroid operation ama will be already 45 years. And it depends on multiple things. One, nipano or fertility wishes, as in obeso nyinsɛn. And that's one person who many na. 2, fibroid na hifaneda. Ewa wodi enim. 3, fibroid na kitikiti bi ana fa wodi enim nyina. 4, fibroid no esu to the extent say man moja tu nipa ni bebre pa say bana say ya nyi bibia fa kweti man twahwe ana. You be consider all these factors near take a decision. Something be anko so also we fibroid. The ko ba ko nyane say so on so obewo ba bi ma oni we shi bia so be nyinsɛ bi ma wa wona mawia. Wobetinu for say me nya wo de ne mom nyɛ dɛ ema wo. Ba se ko ba se opeba. Na fibroids ba bi eda no esododo na eno ne yenim sɛ ne so one of the things a man intimi nyinsɛ ne ade dia. Why no age doesn't matter. We'll take it off for him. Nti betimi ayi amani fa no.
Next question.
We should say, can a woman with fibroid get pregnant? Sorry. Yes, but again, it depends on where baby a fibroid. Can work Canada.
Also say Gina awodi na no baby okay to remove
because say fibroid no ye wo de wo submucosal as a one fan say wodi anim any intramural de wo awodi no so ne muscle no emu any all subserous and here between awodi and muscle and ndra na kata uterus na ho no any all pedunculated and the asa ahoma so and the sensen awodi no ho pedunculated subserosal fibroids usually will not cause infertility or will not cause problems when it comes to fertility unless of course a sododo and then a solidness then a nia awodi na tokro na then cavity na then esi. But intramural and submucosal, especially submucosal fibroids, can cause infertility, depending on how big it is and how it's occluding the cavity. We say, can a hernia cause infertility? Or say, in cause infertility. You see, like, but I'm tempted to think that also make causes of testicular causes of infertility, make a hydrocele, varicocele. You know, honestly, because I said Beman Neshwana back where they are. Say no being an brother near day. It is not directly to say obi hydrocele and I say varicocele chinchina or infertile. No, but it is known to be a cause. A testicular cause of what? Infertility. They are not just a chinchina trying. Then you are to be conclude. Obey to me, I need so. Obey to me about his own. That's it. So I said, exactly. Correct. I say we be so say number 6 I say I'm sorry ni kunu da also sorry na insu ni nam ne na ho eno no yare ana I think that is how I say na me capture no I mean say enye yare enye
why fault your bad fault and I say be man fault
oh I mean so people think that is a cause of infertility enye I mean kasi obi afọ say insu ni nyina best ne ko you don't expect for instance semen to be as thick as starch any fluid, you know. It has its own viscosity. Ti say o kwanye nyina na be ko nyina anko. And in fact nsuo na eko, enkwamo na isi de o se tia say enye nsuo na egu ho na eko. Enkwamo na ewo nsuo ni mu no. Eni. Omo na eko. Enye nsuo na nsuo de eko ba na se na be yon se ba na se ni acidic. Na akọ balance acidic nature na say neutralize ho. Na nkomo na nya kwan den atimi adware akọ ati ase enti enye nsuo na eba no ba nkomo na ekosoro no na eden ehia
na se de nyina nso ntumi mpie sa ebi bekam
na me ka se nkomo na gu mu na tie o nkomo na gu mu na nkomo de omo hu ya mfa omfo ni nye den that's why the microscope na omo de omo ko ati ase enti nsuo na eba na ebi
ya kan se ne se nsuo no
eba no nche untimi nyinsia na se yare ana
enya bibia se ebe diva gina oba no kra ne posture no so
well
bia se bia no
unless of course any part so ka se bia oba na wodi na no nesi ene bia ntina intimi mfam nko I don't know but literally
okay
and I'll be say you can say so be say nipa wantini surrogate mothers no or so make me menstruate ana answer dey be you be surrogate man you prepare no so obegin you know you can say obeje embryo na say abotofo na aform no e de kotuna wodi ya prepare no say make say art no you process you don't go through what you prepare o mansa ahunti ye man wi a ontimi nye dey menstruate wonyinsan
to be menstruation no menstruation no e be twa
you be prepare no so you be senka you go through maybe appropriate time be free ARTs no one some more process one from down regulation
and answer what is the better process you on menstruating
no age nyinsa na show boko and say obi busa say ye fibroid no ya ni say 3 times na beti me
4th time no say le fu aye kese
okay say no person okay say I grow biem yes e beti me grow biem so normally recommend say ye we of opeba na say ye fibroid na say bia de na cause infertility na ye fibroid na once we take out the fibroid no we are now within 6 months maximum you should be able to make plans to get pregnant what you say ko fibroid can grow yes
so insane
ko fibroid bit me dey asa nyini what you say
but until when I say almost to me an operation
yeah of course ya ba sa be bi no so pe body ya so mo say unless of course o ka se na funa ayekese no bibi fufu na dey fukase na ba what you say
na on pe ba bi un dey
and so only one paper the other time say if I know me nya odi na nyanya dey emma but normally the decision to your friend is saying to keep the uterus or to take it out predominantly if say obi or fibroid or na bibia yeah now one of the key things you consider as or fertility wishes or not so when you marry fibroid you have mamu jetu emo wa yase ya more compressive symptom ayekesi ama mpo bi kra
how adwen ya na won pese obewu bi wa na we ye flora yo doc better was say your friend Dr. Richmond Amon our Confanochi Teaching Hospital or Sanso KNUST Hospital and then ya di awo hon komo midin the kosi asise Nicholas Suma no ye executive producer na Daniel Nkrumah o chinchim efide ni man past care for ebeba omonso mbeka hospital no ho nkomo past care hospital no nkomo ehwam and a house of new glory so at the osum ebebre yebeda Dr. Richmond Amuase yebeda mu nyina so ase se mo de mafidie no atohana motie this very powerful educational and interesting program. Obesa baby am ya to so see bibi the ART no de se to ebo ase nye chire mu pa because se untimi nwa no nkyere se enu ano no se wu untimi na untimi nkura ba no a ebetumi akwala no ebetumi dia ma obi amana akare na ma ni nyina asesi anom se nimdia na kwa animu nti for fidie no to ha why Madam Wasi, if you didn't because he said, you better VGL for Swasi.
V, very good. G, great performance. L,